Encounter is brought to you by the Broome County Council of Churches, where we connect compassion with needs as we inspire growth with dignity. You'll find us in special places throughout the community. For those who remain hungry, we provide meals. For those who are challenged, we build wheelchair ramps. We comfort those who are ill, minister to those who are confined, and we remain an advocate for change and understanding on behalf of every element of our community. Connect and inspire. Encounter the Broome County Council of Churches.
Good morning and welcome to Encounter. I'm your host today, Joe Sellepack, the Executive Director at the Broome County Council of Churches. Today's lectionary reading has a woman who is bent over and unable to look up in people's faces for 18 years. She was possessed by an evil spirit. In our community today, there are a lot of people that are bent over by shame, by guilt, associated with addiction. They can't look at other people in the eye. They can't look at themselves in the eye. Looking at themselves through their own eyes would be one thing, but they often will have to look at themselves through the eyes of their addiction. And that changes how we view ourselves. And it's very, very sad and very harmful for people to have to live in that kind of an addiction for very long, let alone 18 years. One of the things that we at the Council of Churches believe is that people need to be free from addiction, and not necessarily freed in the sense that they're ever going to have to learn they're ever going to be totally free from it, but that we are all in a state of recovery. We have to pick it up every day, learn to live and learn to be operating in recovery instead of outside of that. So we're going to talk a little bit about recovery today. What do you think? Does that idea that a person needs to address their addictions, is that something that you think is really important?
Absolutely.
It's not a problem that'll just go away if you ignore it.
Right.
It has to be addressed.
And it affects families too, doesn't it?
Absolutely.
Not just the individual who's taking the substance, but it affects the entire family too, right?
Yes.
And
it's a family disease.
It is a family disease, and often it runs in families too, right?
Yes.
So people have genetic predispositions.
Yes, I believe so.
Yeah,
absolutely.
Anyway, and today I have a couple of guests, Don from Fairview Recovery Services, and Michele from Fairview Recovery Service. Michelle's the Executive Director, and Don is a
case manager with the Addictions Crisis Center. Yes.
All right, very good. Welcome to Encounter. Thanks for being on today.
Thanks for having us.
Yeah, it's really good. So you want to talk a little bit about Fairview Recovery Services? What does Fairview Recovery Services do?
We offer a continuum of residential services, starting with a crisis center on Court Street, and pretty much a step-down process until somebody can be on their own. We highly value people getting training, working towards some kind of goal that'll give them a livelihood so they can feel like productive citizens when they leave and have real life again. And we'll see them through all the way to the end program, which is Shelter Plus Care, where we pay part of their rent through HUD grants and really give them case management until they can go out on their own.
So
that continuum of care begins perhaps with the crisis.
Yes.
With the crisis counseling
it can
center?
start with just a phone call or actually a knock on our door.
Yeah, so people just show up?
People can just show up to the door and ask for a bed. If we have one available, they would get it. Yes, absolutely.
Very, very good.
But the best way to start is with a phone call.
With a phone call? Yeah, well, it always is good to warn people that you're coming, right?
Yeah, sure.
I've been a pastor of a church, and sometimes you have to do a cold call, and it's never good.
Well, the other issue is we're often full, and we would hate to have somebody just come over and not be able to let them in.
Not be able to.
So if they call, we can get them on a waiting list.
Right. Very good. And so addiction is a huge issue in the community, and it gets almost constant billing from in the paper. You almost always see something about addiction at the moment. So why is it such a big topic right now?
Well, we're seeing a heroin epidemic, which I'm sure most people are aware of because it is on the news a lot. That's a good thing. A lot of resources have come toward that problem. Of course, the bad thing is that people are sick, and there are a lot of more fatalities now than in the past due to the drug that people are using, which is heroin. There are other drugs that people are using, of course, but that is the one that's in the news.
Yeah, and how do people generally get onto it, an opioid addiction like heroin?
Well, it can start with the prescription of narcotic painkillers. People have surgery or they have an accident, brings them into pain they can't deal with, and it starts with a prescription, and pretty soon it does not take long for a person to become dependent upon an opiate. And what we're seeing is a lot of people are spending money on these opiate pills, and then they're figuring out that they can get the heroin cheaper and get the same effect, and it's leading into that, and then it's leading them into the needle use, which can be a whole other addiction in itself. That instant gratification that a lot of addicts are looking for is right there with just the press of that plunger. It can be horrifying. You're willing to, at any given moment, you're willing to give whatever you have and do whatever you can for that next dose, and right after that you're praying that was the last one you'll ever have to do, and then the cycle starts all over again, and it traps people into this ongoing cycle of guilt and shame and fear, and they can just continually chasing that fix, because that's what they know, that's what they've learned. This is where I'm comfortable at. They don't want to come out of that box.
Yeah, I always that picture of that woman who is bent over. Mm-hmm. I always view that as, I worked in a residential shelter for when I first got out of seminary for 3 years. My wife and I like to say that our kids were born in a homeless shelter. So it's funny. When we tell people that, they go, "Well, what were you?" And we were resident directors. It's kind of our ministry at the moment. But we were dealing with men who had an addiction. Most, I would say, 75% of the people that came through. And the shame and the like you were saying, the shame, the guilt. I can't handle this problem myself, and most of them deal with things like that. And they say, well, of course I can kick this. It's what makes it. So how is it that a person enters into recovery? Like, what happens to them?
It has to lead to where to bring somebody into recovery, just bring somebody to wanting to be relieved of that pain of their addiction. The pain of staying the same has to become greater than the pain of the change that needs to happen in order for a person to recover from an addiction. They can realize that they don't have to do this alone. They don't have to they don't have to fear it. They don't have to be ashamed of it anymore. There's nothing wrong with asking for help, and there's plenty of help out there. There's lots of people like Michele and myself that are willing to help with everything that we can to bring somebody to their full potential, to be able to become that productive member of society that a lot of these people are longing to be. They just don't know how to get there.
And I think what's also really important is that people understand that addiction is a disease. It's not a moral failing.
Right.
And I know that for myself, I've been in recovery since October 24th, 1984, long-term recovery. I'm very grateful. But what really made a difference for me was to understand that it was a disease, and it offered me hope, because if it's a disease, then there's things I can do to get better. And that made all the difference in the world to me. Instead of feeling like a horrible person, shame, guilt, all that, it's like, I had a path.
Yeah, and that path is pretty important. So that's the kind of what you were talking about as far as the continuum of care that Fairview Recovery Services offers. I found it really fascinating to read a little bit about the history of Fairview Recovery, that it started as a mom and pop organization, seriously a mom and pop organization.
Yep. Like you and your wife with the home.
Yeah, exactly. And you want to talk a little bit about the history, like how it started? And and where you came from?
Yeah, I think it was 1970. It became incorporated, but it was a house up on the east side of Binghamton. We're still up there. Our campus is still up there. It's lovely on top of the city, nice view. And it was an old Victorian, and they just helped people. At that point, it was people who had addiction to alcohol. And people could come there and stay, and for pennies a day, they would, they would help these folks. Eventually, it became, we went under OASIS, New York State Office of Alcoholism and Substance Abuse Services, and we're licensed now, and we're regulated by them. But that's how it started.
And people really, how did they find out about it? How did they find out about Fairview Recovery?
Do you mean
off the street? Like, do people just know about it now? Is it like a
Yes, I mean there's a lot of word of mouth of where people can get help. Absolutely, people in their addictions, they like to share where they can get help, and there of course there's the websites, frsinc.org. There's also the hotlines that can be called that they'll direct us to the nearest available help. Absolutely.
And so my guests today are Don. What's your last name?
Garren.
Garren.
Yes.
Don Garren and Michele Napolitano from Fairview Recovery Services, and we're talking about opioid addiction and maybe even greater than that, the addiction issues in our community, because opioid kind of just scratches the surface, right? I mean, there are many addictions that we're talking about. Like we had suggested that at the beginning, or we had stated at the beginning that Fairview Recovery Services started as an alcohol treatment center, and alcohol is still a problem in our county or in our city, isn't it?
Absolutely. Don can tell you at the crisis center where they do intakes daily, most people identify alcohol as a part of their of their substance use or
alcohol,
abuse.
Marijuana, cocaine, crack, and the opiates. We have seen a spike in methamphetamine use too.
Yeah, methamphetamine is like, when you're looking at the difference between methamphetamine and heroin, it's kind of like two poles of the same problem.
Day and night, actually, is a lot of difference, but both addictive substances, both become physically addictive, both become psychologically addicting too, and it's just we can't just only address heroin epidemic. We have to address addiction as a whole. We have to address behaviors. We have to address thinking. We have to address attitudes towards the whole thing, the whole recovery as a whole.
And recovery, that's one of the reasons why it's so difficult, is because you've always viewed certain parts of your life through the lens of. I remember there was this one gentleman who stayed with us at the homeless shelter who only thought he was attractive to women when he was high or when he was on alcohol for him, and so he would always get drunk whenever he wanted to talk to a girl.
Sure.
And that was a problem. Sure. We had to actually sit him down and tell him, the reason that you're not coming away, you're not really meeting women is because of the alcohol.
Because of the alcohol, yes.
The mirror is wrong.
It does lower inhibitions, and one of the things we work on at Fairview is learning how to have fun without drugs or alcohol, learning how to talk to somebody without that, learning how to go to a dance and dance without a drink. That's hard for people. So that's we address that. We address having, recreational activities and social activities when you're not using. Yeah, it's hard.
Well, and I could see where that would be a big problem, especially if that's how you, the only way that you could get release or your inhibitions get outside of yourself was through a drug.
Right. So people can be so uncomfortable inside themselves that they look to get out, And that is a quick and easy way to get out of themselves, is to use the drugs or the alcohol, because they believe that it loosens them up and it allows them to be more sociable. It allows them to be more friendly or funny or a better dancer or, stuff like that. I can say for myself, I've been in recovery myself for almost 10 years now, and I have a lot more fun now than I ever did, with the use of alcohol or drugs. Much less inhibited too, I wouldn't hesitate to get on a dance floor and dance and have a good time, because it really is a good time to not be focused on wearing that mask that the alcohol and other drugs provide us.
Yeah, and it really is a mask, isn't it?
Absolutely.
Absolutely. Talk about that mask. What happens to a person?
It can allow a person not to feel. It can allow a person to do things that they normally wouldn't do. It can take that shy person and turn them into that sociable person, or it can take that person that is dealing with some mental health issues like anger, or they're just scared of people, and it allows them to feel normal. Mm-hmm. And for a lot of people, that's what all they really want. They just want to be normal people, and unfortunately, they've been lured into this facade that this will allow me to do this. I'd rather be that person than myself. I'm scared to be myself, but I like this person. And before we know it, we're addicted to that, and we're doing things that we normally wouldn't do. And by the time we realize that, we're trapped in this cycle of addiction, of the guilt and the shame and the fear. Like I had said earlier,
because you have to take
like a puppy chasing his tail, around.
Because the mask does come off.
The mask does come off. Yes.
Right. A lot of the work that gets done in addiction treatment is learning to feel feelings, because when you use, you're stuffing your feelings and you're not feeling them. So that's actually a lot of the work that gets done, learning to feel feelings and deal with them in a different way.
To show people that it's, first of all, okay to feel. The feelings won't hurt you. Some people that are in recovery or early recovery are scared to death of their own feelings, because they don't feel that their feelings are justifiable and right.
Oh, right.
I don't have a right to feel like this. I'm not supposed to feel like this, and they want to mask that with the drugs and alcohol, because that's what allows them to do.
So if a parent suspects that their child, even if